Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on HPR. In this segment, we'll be speaking with Mr. Scott Montgomery, CEO and Director of Advanced Health Intelligence. It's a technology company developing smartphone-based human scanning technology. He's going to talk about their name change, a little bit about the acquisition of Wellteq, a Canadian digital health company, and the enhanced capabilities of the AHI platform with the integration of Wellteq. Welcome to Health Professional Radio, Scott Montgomery. Thank you for taking the time.
Neil, it's a pleasure to be here. So thank you to you and your listeners for the time.
Well, tell us a bit about yourself.
Very quickly, Neil, I'm a New Zealand-born, bit of a health fanatic, exercise physiologist by training, and grew up with a family with parents of a physiotherapist and a serial entrepreneur as a father. So I've lived in Singapore for the last 10 years, and this place of Central Asia here is a beautiful place to call home. So that's me in a nutshell.
Now, I understand that you're offering solutions to healthcare providers, insurers, employers, and governments as well. Tell us a bit about Advanced Health Intelligence and these solutions, if you would.
Oh, look, it's what we've put together in the last 12 months, assembled rather, strategically is very powerful. So it's a B2B business model. It's a digital health solution set. And we sell to, as you say, those four customer segments of government, insurance, healthcare providers, and selected enterprise verticals. Essentially, our function for a user is that we can use just the mobile phone, no other connected device, not a smartwatch, not a ring, not anything else. And we can calculate and estimate to a high degree of accuracy your biometric health risks. And they include body fat percentage, dimension measurement, blood profile proxies like triglycerides, cholesterol, HbA1c, and we're able to do this anywhere where you've got smartphone connectivity. So you don't need a health professional, you don't need health training, and you can conduct this entirely by yourself and get some pretty remarkable insights into the internal and the external, very comprehensive view of your health status and risk.
Now, is this the world's first on-device smartphone scanners?
Oh, we've seen a lot of activity within the FDA in the last 3 to 5 years in particular, especially with the rise of some of the software as a medical device and digital therapeutics coming through. What we do have is pieces of technology around the world that are doing aspects of what we do. We're yet to come across anyone that can do it in entirety, and we've been smart enough to wrap some fairly comprehensive patents around that. We've got an extensive patent portfolio. So to be able to go through the sequences that we can to understand vital signs, biometrics, correlative insights into your blood proxies, we're yet to see anyone else on the planet do that. It's very unique.
How accessible is your technology to the average patient? Are there any special things that need to be set up in the home? Are there any special settings that need to be downloaded other than what the person has? Is it compatible with Android technology?
Well, compatibility is iOS and Android, you're right. And we power our partners' ecosystem with our SDK or white label function. So we can sit inside websites, so we can do a URL scan, for example, for blood pressure, respiration rate, heart rate, and we're offering that, and we've got telehealth providers where we work with as our customers and partners. In terms of accessibility, that's one of the biggest problems that we're endeavouring to solve, because part of the problem with healthcare is it takes a lot of time, and you have to sit inside opening hours for physicians, and if we can bring that to the mobile phone in the same way that the other sectors have brought ubiquity to their sector. Look at media, look at fintech, look at music, look at e-commerce. Now there's no closing hours, and you can pretty much run any of those functions from your mobile phone. We're endeavouring to do that from a lens of healthcare, and so we offer that to our B2B partners. We're not B2C, so we can't be downloaded from the App Store, Neil. We work with those insurance providers, government offerings, and healthcare providers to empower their solutions. We're an augmenter as opposed to standalone at the moment.
The last several years, we've heard a lot of talk about HIPAA laws, confidentiality, keeping patients' information confidential. Do you find that is less of a concern now that we have technology such as yours, or is it still a high level of concern for patients' privacy, even though we have access to each other's information on a daily basis?
Look, I think we've got more savvy consumers now around the value and the risk of data breaches, and that's a good thing in my view. Anecdotally, we see more people using their mobile phone for health reasons and monitoring than we do for banking or for job searching. So we know that the utility is there. And to be honest, look, some of those requirements around cybersecurity and data protection, they're table stakes. If you don't have that, you don't belong at the table. And you have to invest heavily for the latest guidance, especially being multi-jurisdictional, as we are. We're a global offering. There are nuances between geographies and different sovereign requirements. So we invest heavily into it. I think that the appetite or the functionality that the pandemic brought about, having to check into places, probably brought some comfort around there. But I would say the concern's high. There's just a bit more savviness or comfort around the function of a phone for health utility.
Let's talk a bit about the thinking behind your recent acquisition of Wellteq. How does this fit into AHI's overall strategy?
Look, I think it's a bit of a mastermind strategy, to be honest, and I can say that because it wasn't entirely mine. I was the founder of Wellteq, co-founder of Wellteq and CEO that was built out from Singapore. We were the target from AHI, along with a biomathematical modelling company out of South Africa in the middle or third quarter of 2022. So putting them together, the advanced ability around body imaging and computer visioning of AHI's initial core technology, coupled with biomathematical and risk modelling, as well as the triage and escalation or personalisation function of Wellteq, means it's an end-to-end solution. So rather than being piecemeal feature by feature, sort of knocking on doors and trying to sell one thing to many people, we're now able to sell time in a lot of ways to our customers, because insurance companies' core competency is not IT or software development or cybersecurity for that matter. They're improving, certainly, but we can now offer a package which can bring speed to market as well as novel functioning. And so being able to do that in the manner and the sophistication that we do, with a very simple end user experience, 30 seconds we can give you an indication of vital signs and stroke and cardiovascular disease risk. It really is that simple. But I think that the coupling or the assemblement of these very complementary technologies and teams, might I add, we now have offices in 6 countries. We've got a team with deep expertise from running global insurers into, big exits of data businesses on our board. So we're a very high caliber function, still a small operation, but we're looking to get that market cap back up and over 300 million where we were at the height of times before the pandemic.
What's next for AHI? What new technologies or innovations do you expect to be working on? And briefly, how do you see the company evolving in the next couple of years?
Look, our biometric health assessment is, at the moment, as I say, we've not seen anything else, so it's unparalleled. We'll be bringing that into commercialisation, and the company's corporate targets are on track for cash flow break even this year. So as a NASDAQ listed and ASX listed proposition for, scalable healthcare technology, that's a beautiful thing. So we'll get to that. Website, you can find a lot more information at ahi.tech, very simple, and that's the way that we like to present user experience. And our ticker code across both the ASX and NASDAQ is AHI for Advanced Health Intelligence. We've got a very exciting 12 months and beyond, for that matter. So come and have a look.
Scott, it's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio. Thank you.
Appreciate your time, Neil. Thanks to your listeners as well.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Scott Montgomery. Audio copies of this program are available at hpr.fm, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.